evening, Claire. How are you?
I'm good, Katrina. I'm good. How are you? Lovely to meet you.
Yeah, I'm also good, and it's my privilege that I got the opportunity to meet you. Would you like to introduce yourself?
I will. It's my privilege as well to talk to whoever this needs to hear this. My name is Claire Burke. I am a nurse. I'm qualified about 24 years, I would say. I trained in Edinburgh, in Scotland. I'd always a love for neuro, stroke. My first placement was in stroke rehab. I came back to Ireland then after I trained, and then I worked for a year in general surgery and doing agency. And agency means you work in different hospitals all over the place, and a great way to get experience. Then I got a job in Beaumont in Dublin, and that's like the neuro centre of Ireland. So, and I was there 3 months, and they said, like I was only qualified a year and a half, and they said, you do the postgraduate in neuroscience. It was a baptism of fire, but it was brilliant because I was rotated around 4 different areas: neuro ICU, neurosurgery, no, 3 areas. Oh yeah, pediatrics is a neuropeds as well, and neurology, and I settled in neurology for a while. I worked there about 7 years. I could feel like getting a bit burnt out. I always know when to change. And then I decided to do primary school teaching, but this was during the recession as well. So I was working the 2 jobs. And while I was doing primary school teaching, I was working in Beaumont Hospital, all over the hospital, and I gained experience from ED to oncology to, everywhere really, ear, nose, and throat, everywhere. Then it was too hard doing the two. My heart, like the principals were really good to us in the schools and everything, but it was very difficult the Monday to Friday, and then every second weekend having to work in the hospital. But my heart really wasn't in it, and I missed nursing. So when I moved back down to Limerick, I started off nursing again full time. I had about 3 months of ear, nose, and throat in Dublin before I did that. And then, like that, agency work is a great way to find out where you want to be and get great experience. Did a lot of A&E here in Limerick, but at the same time as working between A&E and the hospice. Um, then I went to general medical ward, then nursing home. I loved it in where the hospice is. And then I did 7 years in the stroke unit, where I found a bit of a difference now between the stroke, the management of stroke in an acute neurocentre, and then not in an acute neurocentre, because there was time, like delays in recognising stroke and signs of pressure in the brain. And so I went back and did my postgrad again, the same one, in the College of Surgeons in Dublin. And I did the CNRN exams and the SCRN exams, and the American exams that were brilliant. But I left there 2 years ago, and I'm full time in the hospice and palliative care. So that's me.
That's very nice and very meaningful and informative material you have shared with me. Thank you so much. I really appreciate the information. Thank you,
You're welcome.
Claire. Yes. And you are from Ireland, I guess.
Yes, yes, yeah. Limerick. I'm from Limerick in Ireland. Yeah.
So, how is your country? 2, 3 lines about your country.
Oh, it's lovely. It's really lovely. Yeah, it's really peaceful. It's lovely and vibrant, and a large Indian community here, which is great. When I left the stroke unit, I had a great night out with all the Indian girls, so it was brilliant. Yeah, so it is quite, and it's quite progressive nursing wise as well. There's lots of opportunities, and for education and to go into management if you like that. But I'm a bedside nurse, so I always will be, because I think someone with my experience, and I'm not afraid to use it, and I will talk up. I'm quite a strong patient advocate. I think I'm needed more on the floor than anywhere else. And I like the shift work as well. But you do need experienced people. And you do need patient advocacy, because I think that's something that's dwindling. People just don't talk up for patients anymore, which is a bit sad, and it's needed. But but there's huge opportunities here for progression up to PhD levels and all that. Yeah.
Thank you, Claire. So, as we have known about lots of information regarding you and your work culture over here, I would like to know that what was the specific moment when you realized that healthcare was your calling?
Well, I was in college in Cork. Cork is a city here in Ireland, and I was doing science, and I was doing science, but I've no clue of maths. So anyway, but there was a nice part of it was zoology and ecology. So if that was a plain course, I'd probably still do that. But so I did that, and I wasn't great at it. But then I did another year of arts. But then I got a job part time as a healthcare assistant in one of the hospitals in Cork. Previously, like in college, I worked in a shop, and that kind of gave me the social skills, I suppose, that I didn't really realize I had, and that people kind of liked chatting to me, and I liked chatting to people. But it was working as a healthcare assistant in Cork, um, that gave me, like, I wanted to get into nursing then. Always did try to get in, just didn't get in here in Ireland. So then I got in Edinburgh, and it was just a beautiful place to work. The NHS is a good place as well. You very much did what the nurses did, and you learned on the job. Um, so that was it, yeah. When I first when I got that job in Cork as a healthcare assistant in a maternity ward, I knew then I wanted to be a nurse.
So you
And I'm from a
wanted to
family of nurses.
you wanted to be a nurse by yourself. You didn't got any push from your family or any somebody
Oh
who
no,
is.
my mother didn't talk to me for a month when I said I was to go nursing. She said, "Oh no," she was like, "No," because two of my sisters said no as well. My older sisters, so no, no, because it's a tough job, but no, I do love it. Yeah,
Yes,
no,
really.
no.
Is a very tough job indeed, and but still you kept your mentality that you will be doing nursing or you will stay in healthcare. That is very pretty commendable that you stayed in your
Yeah,
route.
I think it's in me. I think you have to love it. Yeah, no, you have to love it. You do. You have to love it. Otherwise you just do harm. I feel if you're in it and you don't love it, do you know. So yeah, you can find something else to do because like the patients look after consents if you're not suited to it. Yeah.
So at this point of time, I think of a question that you liked nursing and you started your career with nursing. But at any
Mm.
point of time, did you felt that you are getting stuck in a specific role in your career where you didn't get any hope of any growth or having restricted pathways in your country? Do you ever felt like that?
As I said, I kind of noticed a difference. In Dublin is very progressive. You're very encouraged, whereas kind of outside Dublin, it can be a little bit more restrictive at times. Like I suppose I was so used to like the polar opposite in Dublin. I was only there 3 months, and they said you're doing the post grad, and like from a busy neurosurgical ward, and I'd no clue. But I learned very quickly, and I had a great nurse manager who had our backs, but made sure we learned as well. It took no nonsense from us as well. Very good work ethic and how to manage our patients. But then I found that when I moved back home, it was harder because there wasn't that understanding about the critical signs of neuro. So that's why I went back and did my courses. And then I didn't get much support when I did the CNRN or the SCRN exams because they didn't know what they were and they didn't know how hard they were, they're very hard exams, but they're fabulous. Um, they're really, the stroke, and the more I got into it, the less I knew, kind of, because there was so much in it. But then I felt kind of restricted then. But then I found standards are slipping with stroke, but it was too much for me alone. Even though I brought all the education to try and take on a whole system, But look, there's a lot of education out there now, so hopefully like areas outside of neuro centres do need to be extra vigilant around the signs of neuro decline because we have to transport them often to the neuro centres, and like there's disabilities caused that could be avoided, and so there is a lot of that, and that's kind of that's been. I did a bit of work in that, and the American neuro nurses were very very supportive. And I suppose my ideas around the science of intracranial pressure and how to act in them, like about 250 hospitals in America have taken that just basic concept on board, and they can do what they wish with it. But yeah, I felt that quite restrictive. So then I used to always work in the hospice, and I moved back to the hospice again. They're so supportive in the hospice. And there's a wonderful 8 week palliative care course that I think every nurse and doctor should do with Birmingham. Princess Alice, and it's very much like palliative care is such a huge thing, but it just brings comfort to so many people. So we're very much supportive in a safe environment in the hospice. Yeah.
So you got a very good environment, as you said, that your environment
Yes.
was good. Your
Yes.
you got a smooth, like a smooth pathway to achieve whatever you have achieved right now. Is it so?
Oh, yes. Yeah, yeah, yeah. Yeah, it's like very supportive. But if you know when you're not supportive, but I know when I need to move as well. I know when when I'm burning out somewhere or I've done my best. But I have to say, when I've left the stroke unit, but I'm glad to say now that there's a lot of the nurses that came behind me, the younger nurses. I used to say to them, go and do the College of Surgeons neuroscience course. And they are doing it because a lot of it is online, so they don't have to travel that far. So that's good. That brings hope that there'll be more nurses just raising standards regarding neuro care. But like in palliative, palliative was more established. You know, palliative is more established here, and we have really great palliative care here in Ireland, where we just help people with life-limiting illnesses live
Mm.
well, and they do. They do. We just go with what they need. Yeah.
So, as I could see that you are very passionate about your profession. So
Yeah.
the hurdles are also very smooth to you because you wanted to cross them, you wanted to overcome them. Is it so? I'm guessing you right, isn't it?
It's. I think I just. It's in me. Like I go with what the patient needs, and I think that's what every nurse should do. Just focus on what they need, and you can't really go wrong then. And be a patient advocate, because if you're relying on the opinions of those you work with and kind of outside of it, that can sidetrack you. It's not easy, but if you are focused on those you look after, I think pretty much everything else falls into place. And you go with what they need, and you can see what they need. Yeah, especially if you've had relatives yourself that needed that care, you know what's needed. Yeah.
Although your passion has given you that kick or that boost so that you have achieved whatever you are at the position right now, but still I would like to ask you that was there any turning point in your career somewhere you just got that extra kick and you achieved whatever you are right now?
So a turning point in my career. I suppose the one I know when to leave, as I was saying, and I know when, like, say for neuro, I was burning out a bit in neurology because there's a lot of the huge psychiatric elements into general neurology as well. And to be honest, there was a man that got off the ward and he committed suicide, and I think that was probably me. I was burnt out a bit with that. Um, because and then my thing is for nurses to mind themselves, nobody's fault, but still it's not nice to go through the investigations and things. Just a young man, but you mind each other. But at that point, I kind of knew I needed to change, and I did go to the teaching, which was lovely, but yet my heart wasn't in it. But it gave me good management skills from the school principals because they very much focus on the kids and on us. So if your focus goes too far outside what's right in front of you, that's when things kind of go wrong. And then, yeah, no, I just kind of know when to change, and I know where I'm needed, I suppose. Yeah, where to go to next. As I said, agency work can kind of open up a lot of avenues to you, whereas like I would have never done hospice care. And through agency, I got taken on, you know, so they got to know me and I got to know them. Yeah.
Yes, that means I your dual job that helped you to reshape your nursing career. Is it so?
Yeah. Yes. Yeah. Yeah. So I'm quite, I suppose I'm quite adaptable because when I was teaching, I was worked in all the wards at the moment, and I loved all that because I wasn't in one fixed ward. I could be A&E one minute and then I could be up in oncology or renal or anything like that. So I got great mixed experience that I can bring everywhere, and I think is very much needed on the floor. And I still use it to this day. You know, I'd still have the basics around a lot of those areas. And I suppose in the hospice now, it's not cancer patients. We've a lot of motor neuron disease. We've cardiac failure. We've dementias. We've everything. So it's not just cancer patients that are for hospice care. It's just so all of that has kind of stood to me.
I think that education, that is teaching and bedside care, are the two parts of a single coin for a nurse's life.
Yeah.
Bec-
Yeah.
because
Yeah.
if you are not a good teacher, you cannot be a good nurse, because you have to teach your patients, you have to teach yourself also at some point of time at your career pathway. Do you think that it is something which you would also like to sync with my thought?
Teaching, like for students or teaching in general, just like I love student nurses, but I love teaching them at the bedside. I love watching them do what I do, and then just watching them from afar, not in their faces, but like giving them the real experience. We had a student nurse the other day, and we had a woman having seizures, so I could go through a lot with that with her. Um, she was working as a care assistant actually, but I love teaching at the bedside, and it's so critical. And before I left the hospital, I left a lot of information and policies around neuro and everything for the student nurses. So yeah, teach as I go. I suppose I teach the way I was taught in Edinburgh, do as I do. But there's great, like there is great support. There's great clinical support from the tutors here as well when they come onto the wards. But yeah, no, I love teaching as we go, real scenarios.
Yes, yes.
Yeah.
Yes. So I'd like to ask you that what have you done the transition into the position you are right now in your career? So how did you have done the transition?
To where I now, I suppose it was a gradual one. As I said, I was always kind of working in the hospice, and I did the course. I did the European Cert in Palliative Care, so I'll always keep myself up to date. If I'm working somewhere, like when I started in neuro, I said I have to do the course because I don't know what I'm talking about for people. So I did the palliative care course about 10 years ago, but it's still very relevant. It's very it encompasses everything that a palliative patient would be. Um I just do what's needed when I know I'm in an area and I don't know enough. I find the courses to do it. Like we had a lot of tracheostomy patients. Now I would have looked after them, but I know I needed to go and do more on that. So I did the study days for that. I find, and we'd have a lot of porticats and pick lines as well. And I wouldn't have been too familiar with them, but now I just know what I need to know for the sake of the patients. Yeah, and I'll do the courses myself. Yeah.
So yes, that means knowledge is the key. At every
Oh yeah.
point of time, you should always keep yourself updated.
Oh, always, always. You never stop. You never stop learning. No, never stop. And those short courses are really quite good. The ones that pack the punch, that give you the real information. Like we'd have short courses on anaphylaxis and things like that. The ones that you can really use. Um, oh yeah, you're learning all the time. There's no point in thinking you won't because you will be learning all the time. Yeah, yeah.
So we should not get confined that yes, I have done my 4 years of BSc nursing, or I have added my 2 years of master degree. That means I have known everything at this point of time. I do not require any further information, or I do not require any further knowledge. This thought is not right.
Oh no, it's not because if you're everything keeps changing, and it's great like that everything does change and you have to adapt to what's new. You have to just go. I suppose I've always been that way, and it's always been encouraged. It is very much encouraged here in Ireland that you keep yourself up to date. It's obligatory as well, but like I kind of do it anyway. Like say I did notice the deficit in knowledge from Dublin to here in neuro, but I just have to need to get that knowledge, perfected myself with the CNRN and the SCRN exams and going back to Beaumont and the College of Surgeons because that was great because I was in with ED and ICU and theatre nurses as well. So you get a great mix of real practical sessions as well that you can bring back to wherever you're from. But no, you're always learning on the go and you have to be up to date. You have to be up to date, yeah.
So, what would you like to say to the nurses who are right now? Like your experience, you have a wide span of experience. So,
Yeah,
where do you
yeah.
think that what you should do if you are a new nurse right now? What advice you might go give to a new nurse who is working today?
A new nurse working today, look after yourself. First thing, look after yourself and look after each other. I would say, yeah, look after each other and talk up for each other, talk up for the patients. and keep yourself up to date. Be a patient advocate. I see that being diminished. That some nurses and doctors will walk by someone, they know that they're sick, they know things are changing, but they won't speak up, or they're afraid to say it to a doctor or anything like that. But speak up. Imagine if it was someone belonging to you. So just please, speak up for your patients. And if you feel you're burning out, change is as good as anything. But no, it's a fabulous role to have, and it's a privilege to be looking after people. Um, but yeah, no, there's plenty of opportunities. Like there's so much opportunities for nurses, and um, huge education opportunities, and it's all appreciated. And we all need to be looked after, so we all have to look after each other. But I would say just look after themselves, and then be good to each other. Do you know that if you're working with people who are good to each other, it doesn't matter how heavy, and it is like in the hospice, it's very heavy. We could have like four, it might take four people to turn patients. It's very intense psychologically. But we all look after each other. If we have a particularly sad case, like recently, we have a lot of young dads coming in their 40s that have died, and we just look out for each other. Do you know? Yeah, we really do. So that's the main thing. Mind each other. Yeah.
Yes, yes. So, what actionable step a nurse should take or a nurse should do? A student nurse who is listening today, what actionable step should they take?
They like if you care, you'll get there. If you care, like the if don't worry, if you care, you'll always find your space in nursing. Like the world is big. You'll always find your little niche. So don't give up. Like because I know some student nurses struggle. They think they mightn't be good enough. If they really like it, if they care, just keep going. They'll be supported. Like they like just keep going, and it's a real privilege, and it's great to see the younger nurses come through. They really are great. They're like a breath of fresh air. So keep going, you're needed. Yeah, absolutely, but you'll always be learning. You can take that in me, you'll always be learning. Yeah.
Yes, at experience is nothing like a 1 day or 1 month or 4 months experience can give you the 100% which you want to achieve. It should
Yeah.
be a lifelong learning.
Oh, it's a lifelong learning. It absolutely is. Yeah, absolutely is. Yeah. Oh my goodness, you'll never stop because things keep changing, which is good. Yeah.
So you have to keep yourself updated if you want to stay in this flow of nursing.
Stay in the flow, and you have to go with what the patient needs. You have to go with what they need. And I suppose I can see in the hospice is quite unique in its care for families nearly just as much as for patients. And that's quite unique to the hospice, I think. Your care of the family, because we'd family rooms for them and everything. So you just go with what the patient needs. Just step back and just see what do they actually want and need, and they really appreciate that. Yeah, some patients like you chatting to them, some of them don't. So you just kind of go with what they need.
And what is your outlook on communication? Most of the nurses, I find that they do not go for communicating with the patients. They just take the data and just a short interview session, and they think that their history taking has been done. So, what is your take on communication?
Um, as I said, you kind of read what they want to. Sometimes they might want to talk to you, sometimes they don't. But you kind of that takes a while for them to build up your trust. But like when we welcome them into the hospice, we just settle them down. We just welcome them and just give them a cup of tea, and just come back to them and come and go, and they kind of get used to us then. But you have to make sure you're available. Like if I know sometimes it's busy and you have to do the short admissions or whatever, but just let them know you're there. Um, and if you were delayed, just apologize, but just let them know you are around. And I think that's a reassurance. I know, but like I suppose in the hospice as well, where I am, they have communication courses as well, just to really listen. Um, who's very good for that is Catherine Mannix. She's on YouTube. She's a palliative care doctor, but she does great videos about communication with those that are unwell. So they're worth looking at as well. Catherine Mannix, she's a British lady. But it does take time, but it does take experience. But even if you are busy, just reassure them that you are around and available. Yeah, because it can be. So, but communication is a big thing. Just be human, just be real. Do you know? They love that. Yeah,
Yes.
just be real. Yeah.
Yes, you cannot be functional all the time. You have to
No,
be,
really. Yeah.
you have to care about the patient. You have to think, you have to take the empathy seriously. I guess
Yeah.
the bookish empathy is more overloading to the nurses
Yeah.
than the actual empathy.
Yeah. Well, but you just yeah, that can be tough because like I'd be quite sensitive to people's moods and feelings and sadness and things like that. But you have to mind yourself as well. You have to take good care of yourself. Um, you be empathic, but just let them know you're there. They just, I think, in general, they love to know if you are there. And just being human. That's it. Don't treat it as a business. Just let them know. Look, I am around. I am around. And just be human with them because that's all they want. A bit of humanity. That's what it boils down to. Yeah.
Yes, this is the genuine information that every
Genuine
nurse
information,
should
but
know.
they can tell. Yeah, they can tell when you're not talking the truth to them. So yeah, genuine information. Yeah, yeah. And just be kind. Just be kind to them. Yeah.
Yes, kindness is the key, which we can really make work in a critical situation,
Yeah.
the patient, which the patient is going through.
Of course. Yeah, yeah. Just be kind and like. And if they're not being kind to you, just step back. Just step back. You don't have to put up with that either. But just yeah, step back. But you have to mind yourself too. But you just be human. Or neutral. If if it's tough, try and be neutral. I know it can be hard.
Yes. Thank you so much, Claire, for giving me the
Anyway,
information, for sharing your details or your feelings to me, and also to the viewers who will be watching this video later on.
very good. Lovely. Okay. Thank you.
Thank you so much.
Thank you. Thank you, Katrina. Thank you. Okay.